You know that ache in your knee, that little twinge in your shoulder, or the stiffness in your back? Yeah, we've all been there. But have you ever wondered what happens when you take that pain to a doctor? How do they actually figure out what's going on? Well, today, we're going to pull back the curtain and see exactly how a medical detective cracks the case of your pain.
So, just how big of a problem are we talking about? Well, check out this number. In the US alone, 58.5 million adults have a physician-diagnosed arthritis. I mean, that's roughly 1 out of every 4 adults. This isn't some rare thing, it's a huge, shared experience.
And because of that, you get this number, which is just staggering. 315 million outpatient visits every single year are for these kinds of musculoskeletal issues. Think about that caseload. For every single one of those visits, a doctor has to put on their detective hat and start piecing together the clues.
So this is our central question. How do they do it? Because it's definitely not guesswork, and it's not about just throwing treatments at a wall to see what sticks. There's a real, systematic, and logical process at work, and we're going to walk through exactly how that investigation unfolds. The whole goal here is pretty straightforward. Get to the right diagnosis, start the right therapy in a timely way, and, this is just as important, avoid sending you on a wild goose chase of expensive and unnecessary tests. So where does our detective even begin? Well, like in any good investigation, you first have to secure the scene and look for immediate threats.
So before anything else, a doctor has to rule out the big, scary stuff. These are the red flag conditions. We're talking about things that need action right now to prevent serious long-term damage. Things like an infection that's gotten into the joint, a really severe gout attack, or, a broken bone. These have to be found and dealt with immediately. Okay, so once the coast is clear of any immediate emergencies, that's when the real detective work kicks in. And it all starts with a simple framework, a set of 4 fundamental questions that are designed to immediately profile the case and start narrowing down that long list of suspects. These 4 questions are the absolute cornerstones of the whole process. Think of them like a funnel, taking hundreds of possibilities and, right away, focusing the investigation. We're going to see how each one of these, from where the pain is to how long it's been there, helps build a clear profile of the problem. Let's start with the first 2. First up, it's all about location, location, location. Is the problem in the joint itself, what we call articular, or is it in the stuff around the joint, like tendons and muscles? A simple way to think about it is the problem inside the house or is it out in the yard? Pain inside the joint is often deep and it limits all movement, but pain around the joint, that's usually tender in one specific spot and it might only hurt when you try to move it, not when the doctor moves it for you. Next, the detective has to figure out the motive. Is this an inflammatory process where the body's immune system is attacking itself, or is it not inflammatory, like simple wear and tear? And the clues here are pretty clear. Inflammation often brings redness, warmth, and swelling. And here's a really telling clue. Morning stiffness that lasts for more than an hour. Non-inflammatory problems? Usually none of that. And just like that, with only a couple of questions, the whole game has changed. The doctor has already taken this huge, wide-open mystery and turned it into a focused investigation with just a handful of likely culprits.
All right, so the investigation is now focused. It's time to gather what is, without a doubt, the most critical piece of evidence in the whole case. And that's the story that comes directly from you.
And I really can't stress this enough. Your history, your age, when the pain started, how it feels, what makes it better or worse, that is the most valuable part of the puzzle. This is also where that 4th key question comes in. Is the pain in one spot or is it widespread? Because that one detail can send the investigation down 2 totally different paths. Your story provides the context that no lab test ever could.
Remember that 3rd question about the timeline? Here's where it clicks into place. Is this problem acute or is it chronic? Did this all just pop up in the last 6 weeks or so? Well, that points towards things like an infection or a gout attack. But if it's been going on for longer than that, the detective starts thinking about more chronic conditions, like osteoarthritis or an immune disorder. Next up, it's time for the on-scene investigation, the physical exam. The doctor looks for visual clues like swelling. Then comes palpation, which is just a fancy word for carefully feeling the area for things like warmth or fluid. And finally, they'll assess your range of motion. This is where the detective really gets their hands on the evidence. And during that exam, the doctor might find a really specific clue called crepitus. It's that crackling, grinding, or popping sensation you can sometimes feel or even hear. Now, a few minor pops can be totally normal, but a coarse, kind of gritty crepitus?
Oh, that is a key clue that points straight towards significant cartilage damage, like you'd see in advanced osteoarthritis.
So after taking your story and doing the physical exam, the detective usually has a pretty strong theory about what's going on. Now, and only now, is it time to call in the forensics lab to confirm those suspicions.
This quote is so important. You see, in this field, you don't just run a bunch of tests hoping to stumble upon an answer. That's not how it works. A good doctor uses tests to confirm what their investigation has already led them to suspect. The test becomes the final piece of proof.
And one of the single most useful tests is analyzing the synovial fluid. That's the natural lubricant from inside a joint. I mean, just its appearance tells a huge story. If it's clear and thick, things are probably normal or non-inflammatory. If it's cloudy and thin, that points to inflammation. And if it's opaque and looks like pus, that's a major red flag screaming infection.
And you can take it even one step further. By looking at that fluid under a special microscope, you can literally see the culprits. It's like finding a fingerprint at the crime scene. You see long, needle-shaped crystals? Damn, that's the signature of gout. You see shorter, rhomboid-shaped ones? That's its cousin, pseudogout. The diagnosis becomes, well, crystal clear. So you see how it all comes together? After profiling the pain, gathering the clues from your story, doing the hands-on exam, and using the lab for confirmation, all the pieces of the puzzle start to fit, and our medical detective can finally solve the case. The bottom line is this. Figuring out what's causing your aches and pains isn't just a lucky guess. It's a methodical, step-by-step investigation where every question and every exam is designed to logically narrow down the possibilities until the right answer comes into focus. And having a system like this is absolutely vital, especially when you're dealing with what doctors call the great masqueraders. Fibromyalgia is a perfect example. It's a condition with widespread pain, but often very few findings on an exam or lab test. Remember that fourth question about widespread pain? This is exactly why it's so important. A condition like this can mimic so many other diseases, which is why a logical, detective-like approach is the only way to get to the right answer.
And that is why this all matters so much. This whole process isn't just some academic exercise. For you, the person who's actually in pain, it means getting the right diagnosis and starting the right treatment faster. And it means avoiding all the cost, anxiety, and even the risks of going through a bunch of tests you never really needed in the first place.
So, I'll leave you with this final thought. Now that you've seen behind the curtain, now that you know the detective's playbook, how can you use this knowledge? How can it empower you to tell your own health story more clearly, to be a better witness in your own case, and to help your doctor solve your mystery faster?